And hello and welcome along. This is Kathy Frey from IMCO, from the International Integrative Maternity Healthcare Organisation, and want to welcome along today a favourite friend of IMCO, Dr. Julia Bartrop.
Hello.
And we're doing a joint webinar today specifically on the topic of stress and anxiety in pregnancy, because we both have seen it so much, and it has so many consequences, and there are ways to manage it and deal with it. But Julia, do you want to start with a little introduction explaining who you are and your background?
Hi everyone, I'm Dr. Julia Bartrop. So I'm a doctor in Chinese medicine. So I am a Chinese medicine practitioner. So I use acupuncture, Chinese herbal medicine, breathing techniques, basically to help all of my clients. I do have a passion for women's health. So I treat a lot of women's health, but I do see men as well. I do get that question. So I want to say, yes, I do see men as well. So in my journey, I am treating preconception, pregnancy, postnatal, but then all of women's health. So issues with periods, with stress, with anxiety, with depression, with digestive issues. So a lot of things that can come into pregnancy as well, if you've got these issues prior to getting pregnant. I'm also a mum of two. Here's my littlest. I've got a 7 and a 5-year-old. And they've formed a big part of my practice as well, in how I've sort of got into women's health and more fertility and pregnancy and postnatal care as well. So that's based here in Melbourne in Australia. And my business is Rebalance Chinese Medicine.
Welcome. And for those of you who haven't watched a presentation before here with IMCO with Dr. Julia Bartrop, I just can't recommend her webinars enough. They are some of the most deeply informative and practical and solving webinars that we have. They are just amazing. So if you are particularly, I guess a lot of topics that we've dealt with is things to do with fertility, subfertility, infertility, recurrent miscarriages, preconception healthcare, all of those kinds of topics we've done quite a bit on. And the depth of knowledge that you will receive with watching her webinars is just absolutely phenomenal. In fact, I'd say it's almost second to none amongst our webinars. Just amazing. So yeah, no, it's just Julie is just this, she's like, to me she's like an encyclopedia of knowledge on all of this. Just amazing. And so my background is I'm a midwife, and I'm also an author. So I'm a semi-retired midwife these days, but I had a career as a case loading midwife, and I would do the occasional sort of hospital shift as well, but generally my practice was case loading, which means when you take on a client when they become newly pregnant, and you see them through that whole pregnancy, you attend their labour and birth, and then you do postnatal home visits. So that was my sort of career as really a self-employed type midwife. And sometimes they're called an independent midwife, but we've really stopped using that term in a way, because independent almost sounds like you're sort of outside the square and you're not dealing with the system or something, and that's not really true in any way. So it is self-employed is really the better term for it. So and as I say, I'm also an author, and probably my bigger claim to fame is the book Oh Baby, which has been New Zealand's #1 best-selling birth, baby, motherhood or book since 2005. And then I also in more recent times, as part of sort of working alongside IMCO here on the integrated maternity healthcare topic, have put together this book called Oh Mama, which is a perinatal integrative healthcare, and it's a birth practitioner guide to holistic and maternal neonatal wellness. So that, although it's written for birth practitioners, it is really also written so that it's very usable for the mothers to be, for the expectant mums, and ideally get a copy, as soon as you know you're pregnant, or as soon as you're trying to conceive, actually, because it goes from preconception. But there's a huge amount of information that's really on point of the topics that we're talking about today, as well. So it's another resource to you. But okay, so what we're going to be, as I say, talking about today is stress, anxiety, and pregnancy. And I'm going to share screen, because we've got a very short slide presentation for you. And let's just go into that. Oh, okay. What screen have you got there, Julia? Does that look correct?
Yep, that's right.
Perfect. Okay. All right. So yeah, we're talking about stress and anxiety in pregnancy and the dire consequences of it and the simple cures. Without any doubt, the thing that we both hear all the time is women who are early in their pregnancy who will say something like, "I'm so worried about," or "I'm really anxious about this fear," or I'm stressing out over this. Like, "I'm so worried about this. I'm so worried about that. So worried about this." And it's just something we hear all the time, isn't it?
Mm-hmm. Yeah.
And sometimes it's on the smallest of things, but they don't know that. Like, I can say that perhaps as a midwife, because I know it's a fairly inconsequential thing, and it's it's not affecting your baby or whatnot, but for the woman, she doesn't know yet that is not something to be deeply worried about. So she's incredibly fretful about what it is, and look, it could be, it's usually come from some little comment along the way. Maybe she's had an ultrasound scan and the sonographer said something like, "Oh, yes, I can see there's a fibroid there." And she's suddenly in a panic. "Oh my God, what's a fibroid? And is it going to be harmful to my baby? And what does that mean?" And it could be that she's got a blood test result, and something within that blood test result is slightly outside of normal range, and she can't speak to her obstetrician or midwife for the next 48 hours. So she's panicked as to what that is, and this is crazy. Like, there are some things in pregnancy that women should legitimately have concerns over, and probably the biggest thing that we see, which is a really, there's no way that woman shouldn't feel levels of stress, is when she's had an anatomy scan and the anatomy of her baby is not fully normal. And that's obviously a big deal. And it might be something as simple as the fact that it looks like her baby may have six fingers on one hand instead of 5. It's not life-threatening, it's a little different, and she might be a little anxious on that, or hopefully she will go, "Well, that's how the universe designed my baby, so okay, we'll deal with that later, and it's fine. It's fine." Or, it could be a situation where perhaps a limb is not even forming properly. So that's a big deal. There looks like there's an anomaly within the heart structure. There's things like that are big deals, and they require consultation, and she's going to be through to the maternal. She'll be part of the MFM team, the maternal fetal medicine team of her hospital, where they combine obstetric knowledge plus specialist knowledge, so it might be a neonatal cardiologist alongside an obstetrician, so things like that, where they combine that information. But until somebody's got some really hard, strong knowledge that there is actually something specific to be concerned about in that pregnancy, all of those other worries where she's worried about something she's just not sure about really, and it's just a scary word, or she's read a report that says a scary word, and she goes, oh my God, what's that? And actually it's a normal report. It's just that it's using medical terminology. But all of this anxiety and stress have massive consequences. What we're going to do now is I'm just going to go through the big four that we see as midwives of the consequences of women being unduly stressed. But those are the outcomes, those are the end results. And then Julie is going to go through a little bit more of, I guess, explaining, what's going on in the system, but behind the scenes. But the big, there's a lot of different complications we can potentially see in a pregnancy, but certainly the big four that we know are impacted by stress, potentially just caused solely by stress. Or there's another factor going on and then stress gets layered on top of it. But these are the big four that we see. And so number one is that the mother's body basically terminates the pregnancy. So if it's before 20 weeks, it's called a miscarriage. If it's after 20 weeks, it's preterm labor. And if it's before sort of 24 to 26 weeks, then it's not generally conducive to the life for that baby. And if it's between, let's say, 26 to 30 weeks, then that baby may survive, but it certainly could have some consequences long term of that survival. And generally these days in modern neonatal NICUs and SCBUs, a baby that's born from 30 weeks onwards generally will have a fairly good result, but not always. So we don't want these babies getting born early. They're not ready. And so the reason that my theory on the reason that when a woman is stressed and anxious and fearful and worried and her body just goes into labor is because the body recognizes, or the body decides that this is not an optimum time to have a pregnancy. And that's those stresses that woman is under, which might not be always stresses of her anxious worrying. It could be stresses that she's putting onto her body. So that's because she works in a very busy, stressful job, or she's a gym junkie and she's doing way more physical activity than she should be. So it could be stresses that she's putting on her body, or it could be emotional stresses that she is experiencing. But whatever the stress factor is, the body just goes, look, I can't continue this pregnancy. It's not good for this pregnancy to be under those levels of stresses. I need to abort the pregnancy, and the body will abort it. And we certainly will see that as part of a whole picture with women with recurrent miscarriages as well. It can be part of that picture. So the second one that we'll see is that the woman starts to get hypertension, so high blood pressure. And general terms with working women who are pregnant and working, I would always say that you should be working part-time from 28 weeks and not working from 32. Is when you've got a lot of potential complications that can come in, and stress is absolutely a factor on them, and you just want to be not stressed. And often women will talk about, oh, I'll stop working a month before I'm due. Well, when I say part-time from 28 weeks and not working from 32, well, that is stopping a month before you're due, because you're due at 37 weeks onwards. So that's pretty much a month before you're due. And where people get kind of confused on this month before they're due thing is when they are basing it on their EDD, or their estimated due date, which is a really dumb name for it, because it's not really an estimated due date at all. What it is an estimated 40-week gestation date. and anywhere from 37 weeks onwards is normal. It's not early to give birth. Prior to 37 weeks is preterm labor, and that is giving birth to a premature baby, and that is early. But from 37 to 42 weeks is a term baby. Yeah, so then the other next thing that we'll see is a mother's body develops diabetes. There is certainly lifestyle factors, dietary factors, etc., that can make her more high risk for diabetes. So I'm saying that about 50% of women who get gestational diabetes don't have risk factors for it, but as such, so that's where we have to look and go, well, okay, what's going on? If she doesn't have physical, medical, BMI, dietary risk factors to it, but she's getting it, what else is going on? Well, chances are stress is probably in there. And of course, gestational diabetes is a temporary form of diabetes. When you're pregnant, your body naturally, as part of the normal process of being pregnant, you do naturally become somewhat insulin resistant. And so your pancreas, when you're pregnant, has to work a whole lot harder than a non-pregnant you. You need to produce insulin at levels that are much higher than a non-pregnant you. And basically, some women's pancreases just don't cope with that need. So then they become temporarily diabetic, which is why we call it gestational diabetes. So you might have heard of type 1 and type 2. This is really like a type 3. Okay, and that has consequences for the baby. And then the fourth one that we see is that the baby starts to develop a fetal growth restriction. Sometimes they call it IUGR, intrauterine growth restriction. And that is basically when the baby's placenta is becoming less efficient. So it's not receiving the same levels of nutrients and whatnot that it needs, and oxygen. It's just not as efficient as it should be. And that's because there can be other factors that the mother's body is not in that optimum situation to be able to support her baby's placenta, to be able to support her baby. And so this is where we'll see babies that and the way that we diagnose a growth restricted baby is when an ultrasound is done, and we see that the baby is its estimated fetal weight is sort of starting to fall off the perch a little bit, and a real diagnostic sign is when the abdominal circumference is smaller than the head circumference, because basically with an unborn baby, its head circumference and its abdominal circumference should be pretty much the same. And when you've got a baby whose abdominal circumference is larger than its head circumference, well, that's a robust, good, chubby little baby typically, so long as the mother does not have gestational diabetes. But when you have a woman whose baby's the abdominal circumference is smaller than the head circumference, then we've got a skinny baby. It's that baby's being forced on a diet as such, and it's the last thing we want to be doing to the baby. So those are the outcomes that I see as those are the four commonest outcomes that I will see in pregnant women who are clearly under stress, either emotionally or just because of what's going on in their life. And yeah, but there's a whole lot more that leads up to those outcomes. So that's where I want to hand over to Julia, because this is her area of expertise, is understanding what's going on there.
Okay, so as Kathy said, stress and anxiety does form a huge part and have outcomes that go on in a pregnant woman. For a lot of people that have stress and anxiety during pregnancy, I generally see that prior to getting pregnant, they are also either highly stressed or highly anxious. However, some women, when they get pregnant, this is when the stress and anxiety actually kicks in as well, because their protective mother mechanism kicks in, but it goes into overprotective mode, if that makes sense to you. And then, so we get women who have a heart palpitation. They're like, oh my God, I'm dying, you know, or something's not right because I've had a heart palpitation. Or there's a tinge of blood. It's like, oh my goodness, I'm having a miscarriage. It's trying to explain to the women that this is all normal physiological things that can happen during a pregnancy. Some women experience it, some women don't. But what happens is when stress is in the body, is cortisol is actually produced, which is a hormone. So this actually raises, you can tend to put on weight a lot more easier. So this is where we're looking at gestational diabetes as well. So high levels of cortisol can also cause adrenaline and cause you to not be able to lose weight. Stress can also affect your appetite. So you can have an increased appetite, or some women when they're stressed, or men for that instance, don't eat. They undereat, which also affects your blood sugar levels and your insulin. So we're looking at systemic effects throughout the body with this as well. So anxiety can also lead to postnatal depression or perinatal anxiety and perinatal depression as well. So we need to be very careful with those women and just be monitoring them and make sure that they're not showing other signs of depression as well. They can also, once they've given birth, become really anxious mothers, which can also have mental health consequences. So during this perinatal period, what we're doing is we're actually, well, when they come to see me, I've got red flags. If anything's going on, I'll put a red flag in their file. But it's also talking to them and just telling them this is, everything's okay. In our Facebook groups, we get things like, oh my God, there's no pulse, is my baby dead? And it's like, well, no, it may just be too early to actually be having an ultrasound. And these days with the pregnancy tests, you can, you know, do a positive pregnancy test before you've even missed your period. Whereas in our Mother's Days or our grandmother's days, is maybe, you know, 7 or 8 weeks before they actually recognize that they're pregnant. So we're actually having a lot of earlier miscarriages or chemical pregnancies, which also heighten women's anxiety and stress around pregnancy as well, because we can do the test so early. However, early miscarriages do happen in that 4 to 5 weeks, and generally most women didn't realize they're pregnant until, you know, 6 or 7 weeks. So when women are trying to conceive, I'm always like, please don't do a pregnancy test until you've actually missed your period or when your period is due. Although, you know, a lot of my girls will be testing a lot earlier, as much as you try to tell them not to. So all of this can then cause cascades of hormones and emotions in the body. So when we're not dealing with our emotions, it affects how our body works physiologically, but also from a Chinese medicine point of view, every organ has an emotion. So fear comes from the kidneys, and the kidney is one of the organs that produces our vitality in life. So if we've got a lot of fear, it's actually consuming our essence or the kidney organ's energy, and that actually drains our vitality as well. So you can also see that with clients with stress and anxiety, they become very fatigued, they get tired very easily, or they're having poor sleep at the same time. So the issue with hypertension is also due to stress and raising blood pressure, and the difference with that cortisol as well, which again, hypertension in pregnancy is really dangerous. And yeah, you want to make sure that they are on top of their stress and anxiety. So how we come about it is we will talk to them. How are they feeling emotionally? How are they going physically? Have any new symptoms come up? Where are they in their pregnancy as well? Because gestational diabetes, if they do have underlying factors, such as they're already a diabetic or they've got polycystic ovarian syndrome or polycystic ovaries, they are at an increased risk of diabetes, and they will check them earlier. Or family histories of diabetes as well, then they're at higher risk of gestational diabetes. So I'm always like, okay, we've got this you know, so there are supplements that you can take as well to help to decrease the insulin, or we just put them on a really healthy diet. A lot of people are overeating with the carbohydrates and sugary foods and prepackaged foods. So it's all about nutrition as well, and letting them know what is healthy to eat and what is, you know, maybe not so healthy. Although during the first trimester, your body naturally does crave carbohydrates. So all of my girls will come into me saying, but I'm craving, you know, potatoes, or I'm craving bread, and I'm craving cheese. And I'm like, it's fine, just eat, you know, what you can eat during the first trimester. We'll worry about nutrition during the second and third trimester, because during that first trimester, you're actually making a placenta, which is a whole other organ, as well as a baby. So your body's doing two things at once, and this is what many women forget about. So you do require extra energy needs, although they say, you know, eat the calories according to when you're not pregnant. But during this first trimester, we're actually using a whole heap of energy. So women will feel tired at 5 or 6 o'clock at night. They will be falling asleep. This is natural. It's what your body needs to do, because it needs that time to actually have the energy to create that placenta and and develop the baby at the same time. So if women are like, oh my God, I'm not getting enough nutrition, it's like your body will take exactly what it needs, and your baby will get the nutrition that you need during this time at the same time. So this is one of the foundational worries that many women come in with. And I'm like, it's okay. Everything's okay. Just eat what you are craving, because your body needs it. So if we can do that and make sure that they're eating, then they're getting all of their energy, and that will help with the production of the placenta and the developing baby as well. Now, just because you're eating a whole heap of carbohydrates during the first trimester does not mean that you're going to develop diabetes. This is other things which people come in with. It doesn't mean you're going to develop diabetes. It's just what your body needs. So if you think about it, carbohydrate has the building blocks and the chains and the sugars and the energy that will provide your body with what it needs. So we do need to be drinking water, obviously, and we do need protein in there as well. But if a woman is craving carbohydrate and she just wants cheese toasties or, you know, baked potatoes or whatever, that's good. However, you know, please try and lay off the fried foods such as chips and everything like that, because there's also extra fat and everything in there. So when we look at the baby developing diabetes, New Zealand and Australia have actually dropped the baseline of where gestational diabetes is. So about 50% of our women are now being diagnosed with gestational diabetes. I was in my second pregnancy and I did nothing different to my first pregnancy. However, when my baby was born, she was extremely scrawny and skeletal, and I don't actually believe that I had gestational diabetes. With mothers that do have children and you're getting up at night, your blood sugar levels are going to raise during the night. So if they flag it and they say it's on because that first fasting is raised, if you've been up during the night, your blood sugar levels have already started rising as soon as you've been up. So this is a point that I argue with the medical system. If it's not the hour and the second hour that is raised, but it's the first one you've been up during the night, I will get my clients to redo their test. So, and not at the hospital, I'll get them to go to a GP, blood collection centre and do that there. Because I think too many people, and these are young mums who've got young kids that have been up during the night, they're told that they've got gestational diabetes based on that fact that that first one was already high, but then their first and second ones are actually negative. And I'm like, right, I want you to redo it. So, and then many of my girls who've had a full night's sleep have been under during that fasting.
That's absolutely fascinating, that correlation between the fact that if you're up through the night looking after another child, that your body will naturally be putting your blood sugar levels up. I mean, you are such a pearl of wisdom, and the things that you always say that I'm like, I have never thought about that or heard about that. That makes so much sense.
Yeah. Yeah. So if their hour and their second hour are fine, I'm like, I don't believe you've got gestational diabetes. I want you to do it again. So yeah, and that way, if it's at the hospital, you can't necessarily cancel your test when they book you in, because they book you in to go and see like the obstetrician or the midwife and have it done. And I'm like, just go to the collection centre, book it in. If you need to cancel it, it's easier to cancel it because generally you just rock up with those ones. And if you've been up during the night, there's no point getting it done because your blood sugar levels are already raised. And then you go and you have this 75 grams of sugar hit. And then a lot of my girls say, I feel sick with that. It's like, well, your blood sugar level's already raised. And then you're having a hit of 75 grams, or I think the gestational diabetes is 50 grams. But even so, when does anyone ever sit down and eat 50 grams of sugar in one hit?
Yeah, and that it's generally the 50 grams they do with that 1 hour glucose screen, but then if you're doing the full 3 hours,
75 grams.
75. But as you say, you know, that's a whole lot of sugar in one hit. It's anyway, okay. Fascinating that correlation between being up in the night.
Well, as soon as you get up, your body's like, okay, I'm up, and you're starting to use energy. So your body kicks in. So it's, you know, you're already awake, you're using energy, you're walking. Blood sugar levels are going to rise. So
makes a whole lot of sense.
So so this is one thing that I have found in the last 5 years. Since Australia and New Zealand have reduced those blood sugar levels and the readings, and that if automatically you're just over the 5 level, they automatically will put you into gestational diabetes. And I've been arguing this with them, saying, well, they've been up during the night 2 or 3 times, their blood sugar levels are going to be up. And if, you know, the hour and 2 hours are normal, then their pancreas and their insulin levels and everything is actually doing what it needs to. I'm just finding that a lot of women, this is from my clinical experience, that are diagnosed with gestational diabetes and then have been diagnosed based on that fasting, not the hour or the second hour being raised. Their babies are not necessarily, like if it's the second baby, babies are less than what their sibling was, and they're not as heavy or chunky, they're a bit more scrawny. So, which is what my second daughter was as well. So I sort of looked at her and went, she needs to be cooked for another month.
Yes, we do see that. And at the same time, I think that you know, if we tested every woman at say 36 weeks or something, like right towards the end of their pregnancy, if we tested every woman for gestational diabetes at 36 weeks, probably 90% of them would have it by then. But we obviously the concern with gestational diabetes is it being as a woman having, so often, you know, that women get concerned that they've got it, you know, that's fine, that's natural, but the consequence on the baby is when the woman's blood sugar levels are abnormal a lot of the time. You know, so so when she's hyperglycemic a lot, then that's going to impact her baby. But if her blood sugar levels are pretty normal most of the time, which in those sort of situations with a GCT, where a woman has been up through the night, and so her fasting or her first test result when she hasn't been eating is a little high, but then once she does eat, her body is managing that completely fine. Well, then you have to say, well, that's actually, she's good. Or anyway, so it's and what about your thoughts with regards to growth restricted babies and that stress and anxiety?
So that's definitely a part. And when the body goes into stress, so when we talk about preconception, if you're highly stressed, your body's not going to want to reproduce because it says it's not safe for a baby. So this is the same when you're pregnant. If you're highly stressed, a lot of women in high stress jobs, so your lawyers, you know, judges, like really MPs, have a lot of stress. So
and the ones that do a lot of physical kind of work, you know, so if the mother is a nurse, you know, and she's doing 12-hour shifts,
Yeah.
and she's on her feet the whole time, or she works at a bakery and she's on her feet all the, so it's any of those where it's like kind of that mental stress, isn't it, or that physical stress. It's
Yeah.
just, and the body just goes, oh, this is not an optimum time to carry a baby.
Yeah. So with a lot of my nurses, I ask them to change their shift work from nights as well to day work. So because working overnight,
12-hour shifts down to 12s to 8s.
Yeah. From 12s to 8s. So if you are on shift work, it consumes a lot of your energy when we're meant to be sleeping. Naturally, we're not meant to be working at night. That's when our body is meant to sleep and recover and rejuvenate and repair. And especially in pregnancy, it's really important that you're getting that sleep, because this is the optimum time that your body will kick in and do all of those repairs and help the baby to grow and make sure that everything's going well. Shift workers, I do find, have an increased risk of stress and anxiety during the pregnancy. And I find that they get a lot more tired a lot easier, because they are going from nights to days to nights to days. And the body's under a lot of stress physically with the pregnancy as well. So I always do say, if they are on shift work, if they can please change to days, because that will help the body and the pregnancy as well. Sometimes this isn't always the case. I do highly recommend it during the 3rd trimester, or I say, look, you know, maybe we need to finish up earlier, because your body, it may not cope. If they're definitely not coping, I will say, that's it. You need, this is the advice, you need to stop working now. So
yeah. And even when you do that, sometimes women will say to you, oh, look, I feel fine.
Yeah.
Look, you know, I'm okay. I feel fine. And we can see clinically, oh no, you know, your blood pressure's starting to come up and you're starting to get really puffy, and there's all these other things, and your baby's growth is not growth restricted, but it's slowing down a little bit. Like, we're seeing all these little red flags, and the woman herself will go, oh no, I'm fine. And and I remember one particular situation where a woman was so adamant that she was fine, and she was actually pre-eclampsic, and she was still going to work. Just like, we're all just going, no, and you know, it got very serious very quickly, because things like preeclampsia sometimes can become what we call fulminating, where it just exacerbates really fast. Like, we're talking 24, 48 hours, and it's just getting, instead of 2 weeks getting serious, it's getting serious in 2 days. And because the body can fool the woman, and the body is very, very good at covering the symptoms, because it keeps compensating and compensating and compensating. So by the time the woman herself sometimes can feel poorly, it's really got extreme. Yeah. So let's get into the our next slide. We've basically got 2 more slides that we want to share with you. So we've got a list of cures here, and then we've got some really cool acupuncture that Julia is going to share with you all, or acupressure. So firstly, I think that it's really important for women to understand that everybody has got their stuff that they are dealing with. And when you are expectant, I think that there is this perception that most women out there are having a wonderful, uncomplicated, problem-free pregnancy, and they're not dealing with any other things. And that's just not true. In fact, you know, like, because I would be a caseloading midwife, you really get to know that woman quite well over the course of those months, and you get to know what other things are going on. And, you know, sometimes these stresses are stuff that's completely beyond her control. You know, it might be that her partner has lost his job, or her mother-in-law is dying, or there's all these things that are just general life stresses that are going on, or maybe she has been developing gestational diabetes and that's freaking her out, or maybe the baby has had an anatomy scan and it's showing that there's a concern there, or there's this huge list, like it's a massive long list of things that people can be dealing with without the rest of the world realizing that that woman is dealing with it. In fact, I would say, I used to talk to a woman, I still do, that there's like 4 mountains that you have to climb in the journey of on that maternity journey, and that is the mountain of pregnancy, and the mountain of birth, and the mountain of the postpartum period, and the mountain of breastfeeding, which kind of is its own mountain. And there are very, very, very few women who get through all the ups and downs of those 4 mountains and don't have some kind of complexity or concern or troubles or issues or problems in at least one of them. And every so often, I would honestly say, hand in heart, probably 1 or 2 clients a year, when I would be caseloading sort of 70, 80 clients a year, maybe 1 or 2 of them might have all 4 mountains fairly problem-free. And you're just like, oh, it's amazing. How did you have this journey without having one issue go, really? But most women will be dealing with something through there. So just appreciating the fact that when you are dealing with and something that's kind of outside of your control, and it is a stress factor in the pregnancy, is realizing that you're not alone, and that most women have got something going on that it might be a concern to them. So just having, because sometimes it can be a little bit of a pity party in a way of saying, why is everybody else having these wonderful normal pregnancies, but in my pregnancy I'm having to deal with blah 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 blah. So just know that everybody actually has this stuff that they're dealing with. And then and the second one would be in the moments of anxious worries, it's about realizing that, oh no, I'm kind of drowning myself in all this kind of stress and anxiety or worry, and proactively, intentionally changing that mindset. So it's about distracting yourself and saying, look, it's not good for me, and which means it's not good for me, which means it's not good for my body, which means it's not good for the placenta, which means it's not good for the baby if I dwell in all of the stress and fear and anxiety and worry. It's not helpful. So what do you want to do? Well, distract your own mind, go for a walk, sit on a swing, do some pre-gi yoga, lie down and just have a little snooze, and read a great book, or watch a really good feel good movie, or do some mindfulness meditation, write in your gratitude journal. Just get your own mindset and swap it and go, okay, I can't be dwelling in that. That's not helpful. So I need to distract myself with something else. And then you've got this kind of taking charge in a way. The Bach's flower essences, particularly, there's a combo one called Rescue Remedy, and there are many homeopathic tinctures that are fantastic for anxiety and stress. And when I say many, it means that you can look at the very specifics of the characteristics of that anxiety, stress, fear, worry, etc., and you'll be able to see which characteristics they are and what particular homeopathic tincture will be helpful for that. And the Bach's flower essences and the homeopathic tinctures are all completely safe in pregnancy, so that is fine. And in the Oh Mama guidebook, then it lists those, there's a good list there that you can refer to as well. And a huge should be doing this from before conceiving, before trying to conceive, is investing in seeing a naturopathic wellness clinician. So I sort of describe it that you've got your allopathic maternity unwellness specialist, and that is your obstetrician. But your naturopathic maternity wellness clinician is your medical herbalist, your naturopath. So it's you don't want to be seeing just the person who specializes in unwellness. That women need to be seeing the person who specializes in wellness as well, because they're the two sides, to that coin. So they will, when you are seeing a medical herbalist like our Julia, that's when they will put you on a customized regime of supplements, and that is perfect for your particular body. I'm talking to the woman level here, and obviously a huge amount of our database here, dominant is actual birth practitioners, maternity healthcare providers. But you can share this link with your woman as well. And then utilizing acupuncture is particularly one. Well, I'll let Julia explain that one because she's the acupuncturist. But it's all about the energy, meridians, etc. So I'll hand over to you. It's your topic.
So basically, traditional Chinese medicine sees the body as it's connected. Everything is connected. So top to bottom, back to front, inside to outside is connected. And the way it connects is through meridians. So we've got 12 major meridians in our body. And if you think about the arteries and veins, just think about another energetic meridian running alongside them. So generally we will have two pairs of meridians. So you'll have a yang meridian, which is on the outside. So the back of your arm, you've got 3 meridians coming down here. The inside of your arm, you've got 3 meridians coming down, and they all connect up to the head. Then we've got other ones that start from the head, go down the back, and come all the way to the feet. So the amazing thing with acupuncture is if you've got a headache, I don't necessarily need to go to your head to treat it. I could go to your feet, depending on what is out of balance. And this is how acupuncture and the Chinese herbal medicine works, is we'll do the initial intake with you, we'll go through what's going on, we'll have a look at your tongue and pulse, put it all together with what you've said, and we're like, right, this is where the imbalance is, this is where we need to clear a pathway if energy is blocked. So if energy is blocked, if you think about a freeway, you're on a freeway and you're going 100 and all of a sudden you've got to slam on the brakes because there's roadworks. And then you're going sort of stop, start, stop, start, stop, start. And then you get to 100 and you go. That's how energy should be. It should be moving freely, like a freeway, doing 100 kilometers an hour you should be able to keep going free. And that means that the energy is moving in the body. When it gets stuck, that can cause pain. It can cause headaches. It can cause digestive issues, and stress is notorious for blocking energy. Okay, stress and anxiety. So stress affects the liver and gallbladder meridians, and anxiety affects our heart meridian. So when we're looking at stress and anxiety, we're looking to free flow that energy. We don't want it being blocked. And with anxiety, we're working through that heart energy and connecting ourselves to our soul and to ourself and to the baby as well. Don't forget that mother and baby are one while you're pregnant. So we connect them to the baby at the same time. So this is how acupuncture works. So once we actually put a needle in, MRI and ultrasounds have actually shown that specific places light up in your brain. Okay, so when we put an acupuncture needle in, it also helps to release oxytocin and serotonin, or your feel-good hormones, from the brain, which is how it also helps with stress. So if you've got pain in the body, this also helps to reduce pain levels by reducing that secreting the oxytocin and serotonin into the body, which decreases pain levels as well. So this is how it all works. But a lot of pain is also coming from blocked energy or tight muscles. So we're also looking to unblock the energy and untighten muscles. And we've got different acupuncture prescriptions that we can do for this as well. So when you come to see us, it's not just about the acupuncture. Like Kathy said, it's all about being well and holistic. So we're not just looking at symptoms that you may have, we're also looking at preventative medicine and what may occur further in the pregnancy or during the birth or postnatally as well. So I'm always looking ahead. So when we're doing preconception, I'm looking at how they are, what could happen once they get pregnant, if there's any deficiencies or imbalances, what do I need to correct now to prevent things happening in the pregnancy? And as we're coming along through all the trimesters, okay, what's going on? What do we need to look at? We're always looking ahead to prevent things from happening. So, but this is working with the individual. We're all about working with the individual. It's not cookie cutter. These points are for stress and we do them for everyone, because everyone's different, everybody's different, and everybody responds differently as well. So some people can respond really quickly to acupuncture. Some people may take 2 or 3 times before you start noticing a change. So it all depends on their body and how they also respond as to treatments that we will do with the individual woman. However, it's all about getting her to acknowledge the emotions or acknowledge the stress that she may be under as well. And then we can send her home with acupressure, we can send her home with herbal medicine. I've got a nurturing tea, I've got a pregnancy tea as well, digestive teas. These are all safe to take in pregnancy. But like Kathy said, it's all about mindfulness as well. If you realize that you are just focusing too much on one thing and stressing out and creating, you're overthinking, you're over worrying, and it's just going round and round and round, that also consumes energy, mental energy and physical energy, but also emotional energy, and starts draining different organs, which can then affect digestion. So it's really important that we try and stay in balance. Obviously, you can't always do that. Like during my first pregnancy, my grandfather died. So like Kathy said, there are circumstances that happen that are outside of our control. However, if you allow yourself to feel the emotions and work through it, get support from other people. So you could be seeing an acupuncturist, you could be seeing a naturopath, you could have a reflexologist. I don't mind. I always say to people, I want you to have a wellness team. And these are people that take care of you. So people like, oh, do I need an osteo? Do I need a chiro? So which do you prefer? It's like, which feels better for your body? So we're all about having your wellness team, and they're your support team through the pregnancy, but also postnatally as well and into the future. So that's basically how acupuncture works, and the herbal medicine does exactly the same. We don't normally just give one herb out, they're in formulas. So each herb has its own job. So you have a chief, which will go to main meridians that are affected, and then you'll have the other little, your Indians, which will go out to the different meridians to help with different symptoms. And then you've got a guide who will actually guide those herbs to the area that we need to be working on. So with traditional Chinese medicine, it's always based on the individual. So we can make herbal formulas using powders. However, if you're taking patent medicine, then they're already in the formula and you can't actually adjust those formulas. However, many people during pregnancy don't want to take the powders. They're just like, just give me the capsules or the patent pills. But we also, in the next slide, it's there as well, come into mindfulness. So as Kathy said, go for a walk, make sure you are doing exercise, but not over exercising. So I always recommend pregnancy yoga and Pilates, and walking and swimming as one of my 4 go-tos. You can always...
I'll throw in there that pre-yoga, gentle walking, gentle swimming is so huge. But there's been some really good studies done as far as the volume of it as well. So sort of the current, you might have another opinion on this, but basically what I suggest to women is about 100 minutes a week that is divided up into sort of 3 to 4 slots. Yeah, so that's kind of the maximum. And because we definitely see women who are over exercising in their pregnancy, and definitely see women whose gym instructor is telling them it's absolutely fine. And as a midwife, I'm just going, oh my God, stop it. You can't be doing this. It's too much. And you will see women who, society is really good, too blimmin' good at making the pregnant woman appear as the superwoman who can do everything. And we will see pregnant women out there as Hollywood celebrities or very well-known politicians, or they're leaders in the public, people who are doing their pregnancy and doing these other things, and it's like everyone should be living up to that, and it's complete BS. It's terrible. I just want to say, no, stop it. 100 minutes a week, gentle exercise, stretched over 3 to 4 days. That's it. Yeah.
Yeah, you definitely want to be doing exercise during pregnancy because it has huge benefits and your recovery is really good. You've just got to watch the type of exercise that you're doing. So, and as Kathy said, it's 100 minutes. So if people are doing Pilates, it's like 2 a week, and then we do bits of walking in between as well. So, or, they'll go for a swim once a week, or yeah. So you definitely do want to do exercise, but you don't want to be overdoing it. So, because again, it's taxing on your body. So, and it's the same postnatally as well.
And the whole, because pre-pregnancy, a lot of women, could typically every day be an hour at the gym. That was just their normal routine. And, you do an hour at the gym over 7 days, that's 400 minutes a week. And on top of that, it's the little stress factors that get you there and back from the gym. It's the traffic and the alarm clock that goes off early to make sure you can get that in before you get to work, and all of that. This is too much. It's too much. It's too much.
Yeah. So if my girls come to me and they're like, oh, I'm too tired, I didn't exercise today, I'm like, that's okay. And it's okay.
Yeah,
so tired is the other thing. If you're tired, rest is the big one. So
yes.
Yeah.
If you're tired, rest. Just listen to the body. So we're going to the last slide. Okay. So I'll let you take over this one.
Okay, so here you can see these are points that I use quite a lot in pregnancy. They're perfectly safe. You can do them at any time. Now, the breathing technique that I get people to do is one which actually helps to calm the body down. So it's basically a flick of the switch. So we're stopping stress and we're bringing in the relaxing nervous system. So to do this, you breathe in through the nose for a count of 4, and then it's a really long, slow breath out through the mouth for a count of 8. So you breathe in. So I don't know if you noticed that, but as soon as I started breathing out, my shoulders started dropping. So I can tell if a person is responding with the breathing by where their shoulders are. And generally, I'll get people to do this in a group of 3, and they can do this anywhere. They can do this when they come to see me. They can do it stuck at a red traffic light, stuck in traffic. If they're in a meeting and they're feeling quite stressed, they can just do the breathing. You can do it, without people necessarily noticing. If you need to take a break, go to the toilet, shut the door, sit down and just breathe. You're putting the kettle on, breathe. If you feel like your blood pressure's rising, breathe. We don't breathe enough in society. We breathe into the top of the diaphragm, but we don't breathe into our bellies. And this one gets you breathing through the vagal nerve, and it switches off that stress response and put you into a rest and digest state. So if people are having trouble sleeping as well, I also get them to do this. As soon as they start feeling stressed or frustrated or really irritated, I'll get them to do this. So again, 3 to 6 times whenever needed. You can do it at any time. It doesn't matter. Now, kidney 1 is located on the bottom of the feet. So you can see it's between that 2nd and 3rd toe. So if this is my foot, it's literally going to be here. So kidney 1 helps to calm the mind, and it also helps to ground you and bring you into your body. So you can get someone else to hold the points for you, or you can do it yourself. So just bring your knee or your leg up onto your thigh and then just press the bottom for 3 minutes and then go and do the next one. So how I do this is I can also put tacks on the bottom, which are pressure tacks, so that as people are walking, they're actually applying pressure to the area as well. So every time they walk, it's actually having the effect of calming the mind and bringing them into their body at the same time. The other thing that you can do with kidney 1 is during pregnancy, if you've got aches and pains, is have a foot soak with Epsom salts for about 20 to 30 minutes, and then do this point as well. And that will help with sleep and just reinforcing that calming as well. So pericardium 6 is located on the wrist. So you can see up there, I've got 3 fingers. You put it from the midpoint here. So this actually helps to calm the mind as well, but it also helps with heart palpitations and any digestive issues that are going on. So stress has, it affects so many organs in the body. And when people get stressed, it can also affect digestion. So this is a good one if that stress is affecting digestion, or you're getting any bloating or constipation or reflux. This is a really good one, and it calms the mind as well. So I'll get people to do the acupressure points while breathing. So doing that 4 in and that 8 out. So Buddha's triangle is a really lovely calming acupressure system, and all you need is the inside of your hand. So you've got lung 9 where the thumb is, heart 7 where the little finger is, and then you've got pericardium 6. So I always go left to right and then do pericardium 6. So, or you can hold for the 2 points here and then just apply pressure at pericardium 6. But this one's really lovely in that it helps to open up the chest, helps to open up the lungs to bring more capacity in for breathing. It's really good. It's working through that stress with that pericardium as well, and also working through the lung. So we're making sure that we are getting that breath in that will help to calm the body down. Heart 7 is also used for heart palpitations, for anxiety, for stress, for any pressure through that chest area as well. So these are simple techniques that you can apply at any time in any place. So all you need is your fingers and some pressure. So, and they're just really simple ones that I will give to my clients so that when they're at work, they can just do these. And I send them these images as well. So they have it in a document and they'll just bring it up. I get them to save it to their phones or to their work device, so they can just bring it up and do it as needed.
Yeah, this would actually be a great, particularly great one for birth practitioners and maternity health care clinicians to even just feel free to share that slide on. Yeah, it's just such valuable information. As you say, it's something so subtle that a woman can be doing in the middle of her busy day at work, and it's and even the fact that she knows she is proactively doing something to help the stress helps to relieve the stress. Mm-hmm. Right? Yeah, it's just knowing that you're doing something that helps. Yeah. So you're pregnant and you're working hard at trying to have a not stressful life, but you've got this horrible customer that you're dealing with in the middle of work who can't help but be stressing you out because they're being so demanding or so awful to deal with. And you can just do that subtle little movements and go, right, I'm dealing with the stress and I'm going to breathe in for 4 and blow out for 8, and I'm just coping with what those outside stresses you can't control. Well, look, so that is the end of our presentation today, up at time. But is there anything extra final that you would like to add in before we conclude, Julia?
Stress and anxiety becoming a lot more prevalent in pregnancy, and I'd just like to put it out there to other birth practitioners that traditional Chinese medicine is a form of treatment that is really safe, really effective during pregnancy, and does help the women so much. And it's underutilized. Same with acupressure, it's really underutilized. So if we can just, you know, let women know that there are options, they don't have to be stressed and they don't have to carry this anxiety through pregnancy, and to get onto it straight away, basically. So
yeah, and almost perhaps, you know, be specifically talking about the topic right at the beginning, on the basis that, you know, that there would be very few women who don't get stressed with anxiety and fears or worries at some point in their pregnancy, and some obviously are just more personality wise sort of prone to that. And you do occasionally get women who are incredibly chilled out, and you know, they're actually fine, and they really cope with the most challenging things really, really well emotionally. But the thing that I would say about that is that oftentimes women who are like that, and they're just a chilled out person, it's just who they are, but oftentimes I've found that their partner is the opposite, and it's that whole opposites attract, you know. And sometimes he and without wanting to, you know, have the wrong genders here, but typically it's the male partner who is so freaking stressed, and that's going on behind the scenes. And sometimes he's the one that has to go, look, you need to dial it down, honey, because this is a little worry, and there's big worries and there's little worries, and this is a little worry. And because that's kind of, because then she starts to worry about him.
yeah,
And he becomes another one of her worries. And I've seen that quite often with the postpartum period, where he's kind of coping with the, I say he because he is not carrying a he can't relate to that bit.
yeah.
But once that baby's arrived, well, now they're both parenting, and he'll suddenly get really stressed.
I was going to say with that, men are developing perinatal anxiety when their partners are pregnant. It's becoming more prevalent. And males can also develop postnatal depression as well. So if you are noticing this in your partner, then make sure that they get help as well.
Yeah.
So, and I know in Australia and New Zealand, I think in America, I'm not sure about Europe, but there are helplines that you can call. So in Australia, we have PANDA, so which is like perinatal anxiety, depression, stress. So males and females can call this helpline, and they're available 24/7. You've also got like Lifeline if you're really depressed, or any of these lines. You know, if you do get into a situation where you can't talk to anyone and you really need to talk to someone, please utilize these, because they are there.
Absolutely.
Yeah.
So critical. Well, thank you so much, Julia. And it's just because we both volunteer on the Us Maternity Guru Facebook forum. It's just something we see all the time. And women will be asking a question, and they will always add in about their emotions on it. It's really common. Look, you know, the sonographer told me this, and I'm so worried about, or the obstetrician said that, and I'm so stressed and anxious and worried about, you know, like it's just all the time. And it's healthy to worry about, you know, like we don't want women being so blasé that they don't give a hoot about stuff that they should be worrying about. But though that is rare, you know, it's rare to have a woman that you kind of want to put a bomb under and go, holy heck, you need to really pay some attention to this, because this is actually getting serious. Most women, it's the other way around. So it's just about sort of knowing that it's just not helpful to be worrying on its own and in that fretful state. It's just going to exacerbate the issues going on. So becoming proactive and feeling like you've got some tools in your tool belt that you can use, and say, right, okay, it's reasonable to be feeling anxious, so what am I going to do about it? I'm not going to dwell in it and sit in it, because that's not helpful. But anyway, we've covered that topic today, and we hopefully this will be of help to There's some really practical things there that maternity healthcare, birth practitioners, etc., can now share with your woman as some ideas that they can do. And for those women watching, well, hopefully it's ideas for you as well that you'll find really practical. So thank you so much, Julia. And we just want to wish everybody a wonderful rest of your day. And thank you to those who joined live. And of course, we know a lot of people are watching it afterwards. And yeah, so have a lovely day, everybody, and have a lovely week.
Bye.
Thank you, Julia. Bye.
Bye.